So Shalom Aleichem, I have over here the privilege to meet Dr. Adam Bernheim, which is a doctor, a leading radiologist, that's what I understand. You work together with 50 doctors on a daily basis, and you are seeing how many patients a week?
Our practice sees over 1,800 patients a day.
Wow, 1,800 patients a day, this is high.
Yes.
Let's hope they all have a good life. And we came in to talk, and you said to me before that what bothers you extremely very much is that you see that our oilum is not really aware about the health issues, which is very important.
Thank you very much. It's a privilege to be able to speak for a moment just about smoking and the dangerous effects of it. As a cardiothoracic radiologist, I feel a certain achrayus to just speak for a moment to raise awareness to the public for the dangers of cigarette smoking. I've dedicated my life to looking at images of the heart and lungs, and I see many thousands of cases per year, and lung cancer is the #1 cancer killer in both men and women by far. And I also image the heart, and heart disease is the #1 overall killer in the United States by far. And each of these is, the risk of each of these categories of disease is increased significantly by smoking. I see the results and the effects on a daily basis, many times per day. And it's always frustrating for me to see a disease that could have easily been prevented. Smoking is one of the most preventable causes of death and disease in the entire world. And
I just want to interrupt for one thing. When you say smoking, do you mean smoking and vaping, or vaping over smoking?
Both traditional tobacco smoke and vaping are very dangerous. Each of them has different ways of causing harm and hazard in many different parts of the body, not just the lungs and not just the heart. It's a risk factor for many other types of tumors. With vaping, we see a disease called EVALI, E-V-A-L-I, which has been described as sort of this acute disease that can result in hospitalizations of patients that vape, and they end up having a lot of inflammation and damage on their lungs. That could happen even from just starting to vape yesterday. So there are short-term damaging possible outcomes in addition to all the long-term things that we talk about a lot. And so anything that can be done to raise awareness about the dangers of smoking, it's very clear the medical consensus on this is extremely definitive, and it has been for decades, that this is a very harmful, dangerous practice, and avoiding smoking in the first place so that there's no chance of starting and becoming addicted, and for those that have already started smoking to be able to stop, is one of the best possible things that we could do for our health. I think there's an obligation that we should protect our health. And I'm happy to be helpful to do anything to raise awareness about the dangers of smoking.
What do we know, the medical field? Because many people tell me the same thing. There is no statistics, there's not enough proof that vaping is dangerous. We know, everybody knows about cigarette, as you mentioned. #1 lung cancer is the #1 death in cancers, and it brings heart disease and many other things. What is the proof that vaping is actually bad?
Sure, it's simply not true that vaping is innocuous. That's just a counter to facts. I mentioned just a moment ago EVALI, this disease that's caused by inhalation of vaping, which can cause hospitalizations and has been well documented and well described. That's just a fact that is a disease that exists. And then the potential harms for vaping and becoming addicted to the nicotine, and the different types of vaping and different products and different flavors that can each contain different chemicals that are damaging in other ways and cause other damage in the lungs. Longer term, over the course of decades, we'll have more data to be able to know about the risk of lung cancer compared with traditional cigarette smoke, but it's clear that it's going to be dangerous in its own right. And I think that the more that we've learned about vaping in just the last couple of years has shown that it's more damaging than we initially thought. So I think the initial feeling was that it's dangerous, but less dangerous than traditional cigarette smoke, but that's been called into question now. And I think we'll see over time, the more that we're going to learn, the more that we're going to see that it's very far from innocuous.
You mentioned before one of the illnesses that vaping is causing, EVALI. Is this popcorn lungs, or popcorn lungs is something else?
That's actually something else that's related to more of an occupational exposure to inhalation. Anytime that we inhale into our lungs, one of the fascinating things about the lungs is it's an internal organ which is continuous with the outside environment. So unlike any other organ like the heart or the brain or the kidneys or the spleen or the liver or the pancreas or the adrenal glands, they are protected from the outside environment, and they're not exposed to just the outside world. But there's continuity between every breath that we take in every single day of our entire lives that goes right into our trachea, into our windpipe, and all the way into our lungs directly. So anything that we breathe in, whether that's why lung infection is so easily acquired in this way. If somebody coughs or sneezes, that's why it's an inhalational risk just by everything that we inhale. So anytime that we inhale a smoke or anything else in the environment that is dangerous, that allows that chemical or that compound to cause direct damage. There's no barrier. It can cause direct damage at the cellular level of the lung. It can cause inflammation, which is a setup for so many other problems, either on an acute basis or long term. Having chronic inflammation is a risk factor for development of cancer. That's an environment that fosters tumor growth and the development at the cellular level of mutations and the basis for how tumors form. So that's why smoking in general is often...
It's bad.
Yes, exactly.
What do you say to people that say vaping is, I'm young, I'm still a teenager, I'm a young adult, not even 30, it's good for me. And it's socially accepted all over, and people just vaping non-stop. What do you say to the people that say, listen, I'm vaping for 5, 6 years, 10 years, nothing happened to me? So number one, I want to know, do you see in your practice, you said you have about 1,800 a week. You told me before, I don't remember exact number, how many every year?
We see 1,800 patients a day.
1,800 patients a day.
I read thousands of cases per year.
Thousands of patients. Have you ever seen young people?
Definitely.
Definitely.
Yes, there's no threshold below which smoking is safe. We have very good data in the medical literature that's been borne out for decades that even a very small amount of smoking per day is a significantly increased risk compared to a non-smoker for many types of lung disease, for COPD, chronic obstructive pulmonary disease, chronic bronchitis emphysema, and eventually tumors. And it's not just lung cancer, many other types of tumors also. That includes pancreatic cancer, bladder cancer, esophageal cancer. Almost all causes of head and neck cancer, mouth cancer are caused by smoking too. And also with the vaping, it's not just about the vaping itself, but it's also about the addiction, the nicotine addiction that comes with that. And it's really setting us up along a trajectory and a pathway of becoming addicted to this external substance. And that can lead to the next addiction. Sometimes people have referenced vaping as a gateway to something that's even more dangerous or another step. It doesn't always stop there. That's how it starts. But it can open up a world and potential doors that we don't want to go down of other forms of addiction, of just being controlled by an external substance, which in its own right can be a setup for many other problems down the road.
We discussed cancer. Cancer is probably the most scary word to most people in the world. Are there any other illnesses, not cancer, that caused by smoking or vaping?
Absolutely. There's a laundry list of literally dozens. Just to mention a few in passing, we mentioned that there are lung diseases that are associated with smoking that include emphysema and chronic bronchitis. This is a group of diseases that cause people to be chronically short of breath. They feel constantly at every moment that they're short of breath, that they just can't get enough breath. Just walking across the room might be impossible for them or leave them completely winded. And in severe cases, they'll require oxygen for life. And COPD is one of the leading causes of death in the United States that has nothing to do with cancer. In addition, smoking increases the risk of heart attacks by 2 to 4 times. It increases the risk of stroke by 2 to 4 times. These are very common, absolutely devastating diseases whose risk is significantly increased by smoking. Smoking is associated with an increased risk of aneurysms in the brain. It's a very common cause of amputations in the legs because it affects the vasculature, the entire vascular system, and
vascular system. I want to
the arteries and
the veins.
Yes, and especially the arteries in the legs. If anybody has an amputation, it's probably because they're diabetic or they're a smoker, because these are the two most common things that cause very severe vascular dysfunction, which over time can lead to amputations very commonly. In addition, there are associations between smoking and reduced fertility. There are associations between smoking and asthma, smoking and cataract formation in the eye. There are associations between smoking and many other different types of tumor other than lung cancer. So it's really, there are actually very few organs that are spared. The effect of the cigarette smoke and the vaping is much more just beyond the lungs itself.
One final question regarding the age. What do you say to people? I know somebody that is 100 years old and is smoking.
Anecdotal evidence to us is meaningless. In medicine, we're driven by data that's borne out in peer-reviewed medical literature. That's like me saying that I drove 120 miles on the highway and I was safe, I didn't get in an accident. We're confusing the process with outcome. Just because the outcome in any one given case was okay, it doesn't mean it was the right thing to do. So very nice that somebody made it to age 95 because their grandfather, was a smoker and they lived till 95. That's actually proof of absolutely nothing. Anecdotal information is not an influence for us to make decisions now. It's like a person who has life insurance and they end up living that year and they paid for their life insurance. So they could say, oh, I regret paying. I didn't need it. I paid money unnecessarily. But obviously that's ridiculous. Fortunately, you did not have to use your life insurance this year. Right. Was it wasted money? Yes, but it was the correct decision. So we don't confuse the outcome of what it is with the decision itself. So
even the data on smoking is huge, and the data on vaping is shorter time. You could say indefinite. That the results that you already see from vaping is devastating.
Absolutely. There's no question about this. This is not a controversy. This is not a topic that is up in the air or the jury is still out. Vaping is dangerous. It causes damage in many ways, either by the direct acute inflammatory response, which we talked about with EVALI, or the longer term effects, which we're going to see as we get more longer term data. And of course, like we mentioned, the addictive component within nicotine and all of the negativity and potential consequences of that as well. So this is not a matter of question or something that's really up for discussion. It's just a fact. Do you want the radiology pictures?
Yes, radiology. So what is this picture that we see over here?
Should I explain it?
Yeah, please.
Okay. So I'm a radiologist, and I look at X-rays and CAT scans and MRIs of the heart and lungs all day. And sometimes people ask me, what does a lung cancer really look like? They like to have an idea of what it is. So this is a nice typical example of something that we see all the time. This is a standard chest X-ray where you can see that the lungs are black on an X-ray and the things that are dense, like the bones, are white. So here you can see some of the ribs. And maybe I'll do it from here so you can see a little bit better. And the heart is in the middle of the chest, which contains a lot of soft tissue and fluid, so it's also whitish. And then you can identify over here that in the upper part of the right lung is a mass. I know it's the left side of the screen, but the way it's reversed on the image is actually the patient's right lung is a large mass. You can see the normal left side is actually okay. So this is already very suspicious for a tumor. And then the patient goes on to the next step, which is a CAT scan, which is a more sophisticated type of test that also shoots X-rays through the body at many different slices, and we're able to kind of get a cross-section of the patient's anatomy. So I'm just showing here one slice through the upper chest.
And I see over here one big white spot right over there.
Correct. So the normal lung is black, like you see her here on the other side, with just a few white lines through it, which are normal vessels. Those are normal pulmonary veins. And then over here, instead of a normal black lung, you have this giant, ugly, aggressive, spiculated mass. This is an obvious lung cancer. You show this to any radiologist from across the room, and instantly, within 1/10 of 1 second, they know this patient has lung cancer, and their prognosis is very poor. The chance of survival from this lung cancer is low, and it's just nice to see what a lung cancer looks like. I want to also show an example at more of the gross pathology level of what smoking does to the lungs. This is not a cancer. These are actually the lungs themselves in autopsy specimens of patients that died and went to autopsy. So the patient on the left side of the screen has normal lungs that this was a non-smoker, and they have normal pink lungs. These are healthy, appropriately sized and appropriate
What Akadosh Baruch Hu gave you.
Exactly. And on the other side, unfortunately, this patient smoked, and you can see that the entire appearance of the lungs is just blackened and tarred from the cigarette smoke. And this is just a nice example of the difference between a non-smoker and a smoker.
You showed me before also one picture of, not this, where you see a lung very black, which is not cancer. Something, a different...
Yes, I should show a picture of that as well.
This one, yes, this is what I'm talking about.
This
what
is unlike the lung that we saw earlier, which was sort of a normal lung with architecture of pulmonary vessels, and it did have a lung cancer, but the rest of the lung was otherwise mostly okay. Over here, you can see that this is a patient who has emphysema from smoking. All patients with emphysema effectively have their emphysema because of inhalation of cigarette smoke, and it causes a complete destruction of the underlying architecture and framework of the entire lung. It would be like if you had a house and the entire foundation and the entire framework were being systematically destroyed from within.
And
so,
this comes from smoking.
So this comes from smoking. There's almost no normal lung. You know what happens in the function of the lung is to exchange carbon dioxide with oxygen at
Correct.
the cellular level.
Correct.
That's why we breathe in, and the pulmonary artery, and the pulmonary vein, and the capillary. That entire process requires like the normal functioning architecture. Once that becomes destroyed, you don't really have oxygenation. These people are constantly hyperinflated. They're breathing in at a maximal amount, and they can't even take a deep breath out, and they're still feeling constantly short of breath. It's the feeling of never getting enough air, never getting enough oxygen.
This is also caused by vaping also?
This is also caused by vaping as well, and it's really devastating. So there are people that could smoke and who never get lung cancer, but they end up with emphysema or a sister disease called chronic bronchitis, and they end up having horrible quality of life. A severe case is a patient who will be required to be on oxygen, and they're unable to exert themselves, and they can't live a normal life, and ultimately a very severe case will just lead to death.
This, what you show me, this picture, which looks so bad, this happens to young or old or both?
This happens over time with age. Emphysema is a process that does develop over a longer period of time. So I can see a scan of a patient that has maybe a younger patient who's been smoking for only a shorter amount of time. I can start to see the earliest minimal changes of emphysema, and I know that if they would stop then, the disease would stop in its tracks and it would not progress any further. And if they're going to continue to smoke, then they'll get scanned, one day, a few years later, it'll be a little bit worse, a little bit worse, a little bit worse. And eventually, when it gets severe over time, you have a case like this, which is definitely a patient who's been smoking for a longer period of time.
Amazing.
People also care about the cosmetic effects of smoking. A lot of times we live in a society that's focused on appearance and people wanting to appear younger, and smoking actually advances at the cellular level the process of aging, both at the organ level and sort of at the systemic level, by causing.
So, which
DNA
means even if they
mutations.
don't see it on the face, it's still inside in the organs. They also aging inside.
Correct, and it can be seen in the face as well. I mean, if you ask any dermatologist, like, what is the most devastating thing you could do to your skin, they will say excess sun exposure and smoking, because it increases aging and wrinkles at a very rapid pace. So, for example, these are two twins, which were identical twins,
Wow.
twins that were born with obviously at the same time with identical DNA, and twin A was a non-smoker and twin B was a smoker. So you can identify that this picture taken at the same point in time of these twins, on this side of the screen, they appear whatever age you think they are, and the second twin, who's a smoker, has more wrinkles and advanced aging throughout the skin. They look probably at least 10 years older. Just from
smoking.
Just from the smoking, exactly. And there are ways of projecting what a person would look like
whether if they would stop smoking or if they continue to smoke. It really does make people look quite a bit older. We know that smoking is a very common cause of amputations, which I mentioned before. This is even a very young person whose smoking resulted in a knee
Amputating the leg.
Exactly. So this is also very devastating. And then I mentioned that almost all cases of head and neck cancer and tumors of the mouth are caused by smoking. So I'm sorry that these are very ugly images, but this is just the reality of the damage that are caused to the teeth and gums. Our periodontal disease is also very much driven by cigarette smoking. And some of the pictures are much uglier even. This is an actual tumor of the gums, which is virtually very close to 100%, high 90s percentage of this type of tumor is caused by smoking. So it would be close to unheard of for a non-smoker to get a terrible tumor like this. And this type of tumor is a disaster. First of all, it's very difficult to treat. It's a nightmare to try to resect surgically. These patients don't do well with chemotherapy, or it's very difficult to radiate a tumor like this. So they're very, very difficult to treat, and the prognosis is actually very poor. There are a number of famous people actually that have died from this. This is even a more unappetizing result of a tumor caused by smoking, caused by almost any tumor of the mouth, head, neck, and throat is really caused by smoking.
Related to smoking.
Correct. Smoking also ruins a person's breath, we know that. We talked about the secondhand smoke. Secondhand smoke causes more than 7,300 lung cancer deaths amongst U.S. non-smokers every single year. So this is part of the damage, and of course children, when their respiratory systems and lungs are just developing, they're much more vulnerable.
Susceptible.
Yeah, they're much more vulnerable to the negative effects of smoke. So that's very important to keep in mind. And there's no safe level of secondhand smoke whatsoever. And so we think of the damage that we're causing people around us, especially children, when people smoke in closed spaces.
Smoke.
I am so glad we met. I learned so much, even though I knew we spoke yesterday so much. It's unbelievable. As they say in Chazal, "Ein lo doime re'eh l'shmieh." When you see it live, it's a completely different story. And I thank you so much for sharing your experience. And hopefully you'll be definitely getting one more off cigarettes, one more off vaping, and I know many hundreds more. Thank you so much, Doctor.
My pleasure. And if you would like one more unrelated correlation, we often don't think about, let's say, the financial consequences of smoking as just a few dollars for a cigarette, but a lot of times I speak to a lot of people often about finance and economics and investing. It's something that I'm also very much involved in. And people don't often think this way, but smoking is actually very expensive. So in New York City, this is old data from 2017, a pack of cigarettes was about $14. And so smoking one pack per day is $5,100 per year, which is a tremendous expense. I see people sometimes that are really struggling, and that's a lot of money per year. That's kind of,
but between me and you, addictions does not. When a person is addicted, he does not look at money. Unfortunately.
So if you're not motivated by $5,100 a year, I just want to take for a second. This is part of budgeting. If you take that $5,100 a year and you instead take that amount that you spend on smoking, that's basically just money going down the drain. If you would have just bought a stock in the S&P 500 index fund, just the U.S. stock market instead, over the course of time, so let's extrapolate out $5,100 a year, and we're going to look at a period of a number of years, let's say per year, $5,100. We see that after 10 years, actually the median that you would be expected based on historical data in the stock market, the 50th percentile, is actually $105,000. That means if a person today smokes one pack per day and decides that they're not going to do that, and instead take the money that they would have spent a pack per day, put it in the S&P 500, after 10 years, they would have $100,000, $105,000 on average.
Unbelievable.
After 30 years of just this simple small expense per day, they would be expected to have $1.389 million. So that's the difference between being a millionaire or not being a millionaire, right? I mean, this is actually a very significant expense. After 50 years, a smoker who smoked from, let's say, age 15 to 65, it's incredible, the compound effect of interest.
means that that person, if they would have, for those 50 years, instead of spending 1 pack per day per cigarette, just invested in the market, they would be expected to have on average about $11.7 million. That means the difference over a lifetime between being a non-smoker and a smoker is literally
a millionaire, a multi,
an 8-digit difference in net worth.
Unbelievable.
Just from smoking. So if you're not motivated by the health effects and you're not convinced, maybe you're convinced that you want to become a decamillionaire. Well, if you just take the money that you spend on a pack per day and just buy a simple index fund, that's literally the difference.
Amazing, amazing, amazing. And one final episode that I want to go a little bit about Yiddishkeit, which I had the privilege to speak to you, and I've been in your house, and I see Shas and Poiskim over here, and Menes Forum, and we discussed many halachas yesterday. What do you say to people that say, hey, this is what I make a living of? Just as a professional. I'm asking you as a professional. What do you say to people? It's okay, my son will only have 1 vape, 2 vapes. Nothing wrong if I give him. How do you look at it? I mean, I know you're not a rabbi, you're not a rav. How do you look at it when you are Yid and you see one Yid motivates the other one by advertising the products or just by...
To me, this is an obvious sort of discussion of Vinishmarta Ma'od L'Nafsho Seichem. It's a very rare instance where the Torah uses a lashon of Ma'od. It doesn't say Ma'od by Shmiras Shabbos or putting on tefillin, but when it comes to looking after our health, it uses the expression of Ma'od. We have to be very careful. To me, it's a most basic obligation that we have to watch after our health. That means not doing things that are dangerous, like smoking. It means having a reasonably healthy lifestyle of eating healthy and exercising. And this is just a basic common sense and a basic yesod of Yiddishkeit. I would say also that I might give the mashal of a person who stays in a hotel. Let's say you stay at a beautiful resort hotel and a guest is there for a number of days, and they decide in the hotel room they're not really thrilled with the way the interior decorating was done, and they're unhappy with the color of the wall, the way the wall was painted, and they're not really thrilled with the furniture, and the carpet really isn't their taste. So they decide to just go ahead and hire a painting crew to come in to repaint the room, and they buy some new furniture and get rid of the older furniture, and they have a whole carpet crew come and rip up the carpet to place new carpet. And in the meantime, the front desk of the hotel notices a group of painters coming in and people carrying furniture, and they say to the guests of the hotel, what are you doing? What's going on over here? And the guest says, oh, this is my room, it's mine, I paid for it. I really was unhappy with the furnishings and the paint and the furniture, so I'm just having it redesigned. And obviously the owner of the hotel says, you can't do that. That's obviously something you can absolutely not do. It's not your room. You're just renting it out for a brief temporary period of time. So too, the obvious nimshal is that the guf is just a kli that was given by Kadosh Baruch Hu for a lifetime, for 70 years, 80 years, 90 years, and Hashem 120 years. And it's really just a temporary article that we have on loan, and we have an obligation. We're not allowed to do with whatever we want. It's not ours to do whatever we want to do with it. It's we have to safeguard it. We have to protect its health, and we have to be careful with how we use it. It's not ours. That's why there's an isser. I think one of the reasons there's an isser in the Torah for getting a tattoo is because your body really isn't yours. You can't just like do whatever you want with it, thinking like it's mine. It really belongs to Kadosh Baruch Hu. So also the same thing goes with the fact that we need to take proper care of ourselves. We need to make healthy choices when it comes to what we eat, and we need to be careful to exercise.
Go for physicals.
Absolutely. All the screening exams, mammography for women, colonoscopy for men and women, all like the basic things of keeping of taking care of our health, and that obviously includes not smoking. To me, this is just a basic common sense. It's a basic yesod of Yiddishkeit, and I would say also that exercising that discipline and self-control is one of the major reasons that we're here. Like our tafkid in this world is to be able to... Yeah, exactly. Yeah, absolutely. So, and having self-control and not being a slave to any form of addiction, whether it's cigarette smoking or alcohol or any other form of addiction, or even a food addiction, having that power and that discipline to choose a healthy meal and choose the broccoli instead of the ice cream is part of breaking a natural taiva, which is, when successful, has a lot of positive spillover effects into many other areas of life. Whether it's a person who, in their Avodas Hashem, maybe they want to daven basikin or learn a blat a day, and they want to have success in eating healthy or exercising or being successful in one area and having self-control and discipline. And being in control and not being controlled by whether it's food or a cigarette or whatever the case might be, is part of being in control of yourself, and being successful in one area will have spillover effect in others. I know people that also budget in terms of finance, and they have a difficult time making ends meet financially because they don't have the discipline to not spend, and they lack the ability to save instead of spend. So having success and having that discipline in any one area will have spillover effects because you're building that muscle of control and self-discipline.
And I will go with one final thought. Give some motivation to people. They do decide to know something. I listened now to one of the leading doctors in the industry. Give them motivation to stop. What will happen to the body? Can they reverse? The lungs should become better. The heart should become better. Yeah,
we have to stop. We have to not be under control of an external substance in this addictive form, this addictive, harmful habit, and it will be so beneficial. We're going to feel so much better when we can take a full deep breath, and we can go to sleep at night not having to worry that our risk of all these horrible diseases down the road is so much higher. There is encouraging news, which is even somebody who has smoked a fair amount, once they stop, the risk of, let's say, lung cancer does start to fall. So there is still reason to be optimistic and reason to mitigate a person's risk if they're able to stop. Their risk of, let's say, lung cancer will never quite be as low as a lifetime non-smoker, but it can still be...
You told me yesterday, and I'm sorry because I think it's a very important point. I'm sorry for interrupting you. What is the chance, how much more likely is for a smoker to get cancer than for a non-smoker?
A smoker is 23 times more likely to get lung cancer than a non-smoker, and 90% of lung cancer deaths occur in smokers. So
90%.
Correct. And even the other 10%, a lot of those are patients that have had secondhand smoke. So maybe there's a spouse in the home that smokes, or they work in a place where there's a lot of smoke. And by the way, even if a person, let's say themselves, are so caught up in the addiction of smoking for so long that they feel that they themselves don't even have much hope, even for such a person, if they care about the people around them, their family, the people that live with them, as say children, for example, sudden infant death syndrome has been associated with smoking.
Say it again, please. Sudden
infant death syndrome, SIDS, which causes sudden death in children less than 6 months old, that's associated with smoking. The secondhand smoke in toddlers and children from a parent who smokes is also very devastating. So even a person who unfortunately has reached a point where they've sort of given up hope on themselves, they should still stop if they care about the people around them, including their children.
Doctor, all I can say is one thing. Kol ha'matzel nefesh achas me'Yisrael.
Save his entire world.
That's it. Kille kiyam olam olam. You know, I slept myself. Took me almost an hour. Going back an hour. Speak to you for a long time, yesterday and today. It's such an honor that you have only one motivation. Your time is valuable. You're sitting here over here in front of computers and diagnosing people and reading images, and it's amazing that you gave away the time for one simple reason, to save Matzel Nefesh B'Yisrael. And I thank you very much. You should have a good gebench.
My pleasure.